So this study was a subset of a larger phase 1, phase 2 program studying Larotrectinib and TRK fusion cancers. And what this study actually does is it takes the subset of thyroid cancer patients and looks at how they did overall. The vast majority of these patients were differentiated thyroid cancer. There are a couple of anaplastic thyroid cancer patients that were thrown in there, and I'll discuss those separately. So the background is that the standard of care for these patients at this point is either sorafenib or lenvatinib, both of which are FDA and EMA approved. And most patients are getting these in the first line and second line setting. So the question then became, one, which patients, it's important to know which patients actually are we talking about. And what we found is the TRK fusion cancer patients tend to be in the younger population. So it tends to be the patients who are maybe teenagers or early 20s. And what we looked at is how did these patients do when they were treated with Larotrectinib on this study. And what we basically saw that the duration of treatment ranged anywhere from 10 months from people who had started more recently to over 48 months. So most patients were still on study at the time of this analysis. And these patients did really well, achieving most of the time a partial response at two or 3 months, if not by 3 months, certainly by 4 months. So patients really achieved a rapid response and got to a partial response in a large number of patients. So what we know from this study is that in differentiated thyroid cancer, which I really want to focus on primarily, we saw that 2 patients had a complete response by RECIST criteria, which was 10% of the patients. 81%, in addition to that, got a partial response. So a really, really high response rate in this patient. And then another 10% had stable disease. And as of yet, none of the patients have progressive disease as their primary response. So of the differentiated patients, as I said, they range anywhere from 0.9 to